Okay, good evening, students. Good evening. We'll start from where we stopped yesterday. The assignments I gave yesterday, were you able to check them out? Who did them?
Yes.
Okay, let me hear you first. Say your name. Let me hear you.
Name is Orange.
Mm-hmm. So what did you find out?
Yeah. The major components of a labo compound.
Okay. What are they?
The major component is caffeine. The major it contains caffeine
What
as
strength?
active ingredient and also
What strength? What strength? What is the strength of caffeine there?
I not check. I just get the active ingredient.
Please, anytime you are asked to find out, check component of any medicine, it's very important if you also check the milligram. Am I communicating? The amount present. Okay, what else
Okay.
is there?
I want acid
Hmm?
salicylic.
Hmm?
The name is too long.
Acetyl salicylic acid.
Yes, yes.
That is the name for under name for aspirin. Aspirin is the generic name. That is under name for aspirin. Acetyl salicylic acid is the chemical name. Acetyl salicylic acid. What else does it contain?
Also, nothing. It's
Not.
only it is that they are now look for the search for the uses.
Hmm?
It I now search for the uses because this is the only ingredient that I saw. So they say it's for pain, for fever, for heart attack, for um prevention of blood clot, back pain, rheumatic pain, tooth ache, and other things. That they use for many things.
See what you do. Your assignment is not complete. Find out the strength. You go back again. Find out the strength of it. You mentioned heart attack. You mentioned blood clotting. There's something I want to. That I know my reason why I say you should find out the strength, because it's not all the dose, all the strength of aspirin that can be used for those that are for proper blood flow in the heart, because of in the heart, in the coronary artery, to avoid blocking of the arteries of the heart, coronary artery. There are it's not every there's a specific um, strength of aspirin that can be do that. We call it low dose aspirin. So he this is academics. The more you do, the more you know. You find out you don't know. The more you go back, the more you know. The more you, as you find out that you know this one, you find out that there's something else you don't even know. You keep looking for it. So I will send you back again. Now this time around, get that what is it called again? Get that alabukun. Check the actual strength of this component. Then this thing you mentioned now will lead me to give you another assignment. You plan another assignment. You should go back again and look for vasoprene. That's one they call vasoprene. Look for vasoprene. Check. If you look for vasoprene, you check the component of vasoprene. Write the component at the same time. Write that is the active ingredient there. Write out the amount, the strength of that active ingredient there. Am I communicating? Good.
Yes.
All right, do that. When you come to tomorrow class, we'll bring out another 5 minutes. Look into such, discuss it, give another assignment. You go and keep researching. This is how we keep researching, so you appreciate I want to be linking you to practicals, not only talking theory up and down. We have 5 minutes before we start the new lecture. Let me see what you have seen in the field. Hope this is not telling you. Hope you are not just going online and downloading it. Hope you went to a pharmacy and asked them or where they sell medicine and asked them to see it by yourself. Hope you saw it physically.
I know physically.
No. You go physically. There are places you can go outside there. Even along this road, so there are up to 4 places they sell drug. Make them friends. Link up. That's spare time you people they acquire in a hostel. Go outside. Look around. Make friends with them. Ask them questions. You're a student of this place. You want to look at this thing, please. They will definitely show you. If you look at them, you snap it with your phone. But I also want to see the picture. Am I communicating?
Yes, sir.
So we are going practical now, not just only theory in class. Hmm? All right. So just try it. Then, if you're not able to do it, maybe I'll see if I can liaise with the hospital here. I think that is what I would do. Maybe I will discuss. Maybe by next week I will discuss with their head, so that you people can always go there, look at what they have there, write out the component and submit to me as an assignment. This is what we will do. Every day I will look at what you've done. But for Saturday, Sunday, Saturday, Sunday, Monday lectures. Saturday, Sunday, Monday lectures. You try and go out and do it outside. Am I communicating? Hmm? Am I?
Yes, sir. Yes, sir.
All right, let's continue. 5 minutes has gone. Let's go to what we have today. All right. So we stopped. Where exactly did we stop? We stopped at.
We saw
Hmm?
the example of water in pressurized container.
Okay, you good. I can remember. No, I say that the powders, labels and advice for internal powders. I say that powders are usually mixed with water or any suitable liquid before taking them. Depending, actually, yeah, it totally depend on their what solubility. Now, as I also said that powder for babies can be placed directly into their mouths, then follow with a drink to wash down the powder. I also mentioned that powder should be shaken when you bring out the powder. It should be shaken carefully before dissolving in a liquid and taken. You know that if you bring it out, some of them would have come together to form lumps. Hope you know. Hope you know. So that is why you should do that, so that they will, if they have started forming lumps, they can do what disintegrate properly before you mix them, before you now dissolve in suitable or disperse in suitable what liquid before drinking, before taking the medicine. These are important things you should tell your patient while giving them anything in powder form. Now, you should be extremely careful. Why recording? Why dispensing the powder for external use? After the whole thing, always put that label. It's very important. Put that label that shows that. Put that label for external use only. Am I communicating?
Yes,
For
sir.
external use only. You must always put it. For external use only. And you also explain to them what external use is. External use means that you should not take it into the mouth. Am I communicating? Now, of course, I've always been saying that you put temperature and at other atmospheric condition is very important. So the temperature, any place you are keeping any drug, be it powder, be it anyone, should be in at least a cool place. At least a cool place. Even though I said yesterday, there are some you put that really need a very low temperature. Yeah, but generally drugs should be kept in a cool, stored in a cool place. a cool and dry place so that the heat will not destroy them, and moisture will not do what? Destroy them too. Please, as I'm talking, if you have any question, please ask. If you don't have any question, I will assume that you are following. I'll keep talking. Okay? Anything you understand, please call my attention. Don't keep quiet. Don't keep quiet. Because if you keep quiet... Huh? You say what?
You said that you should write one level the code. You should make sure you write this thing. Keeping a good shelf.
Yes.
What about the shelf life? It must be included.
The shelf life of... You mean whether it is already in shelf? Let me understand your question. Sorry. You say what?
I think that when as in the label, the shelf life will be included.
In the label, yes. Now, if we extemporaneously prepare product, you should tell them to discard the remaining after. Let's assume that the shelf life is 2 weeks. Most of the extemporaneously prepared product is normally within two weeks. Let's assume that the shelf life is 2 weeks. The label will include discard after so data. Am I communicating? What it means that if the patient use it and if anyone remains by so date, the person should do what? Discard it. Have I answered that question? Have I answered that question?
Yes, sir.
So that is how to factor in the...
Yes, sir.
Okay, that is how to factor in the shelf life. By telling them, you don't go and start write for them shelf life. They don't even know what is shelf life. Shelf life is for your own consumption. So all you need to do is to interpret that shelf life and put it in label that they should discard the remaining after so date. Is it clear?
Yes, sir.
All right, let's continue. Now, uses of powder. Let's talk about uses of powder. What are they used for? In this use of powder, there are this use of powder is all encompassing. I'll talk about both clinical, pharmaceutical, and other use of powder. Am I communicating? I'll talk about clinical, pharmaceutical, and other use of powder. Now let's start with the let's start with like this. Powders as used as, of course, they are used as in the dusting powder. In dusting powder, they are used as a counter irritant. Hope you know that prickly heat. Hope you know that these heat rashes can be. It irritates the skin. Hope you know.
Yes, sir.
So powder there, as in using dusting powder as counter what? Irritants. Am I communicating? Use as counter what? Irritants. Now, of course, this one you don't need to be told that this one is for external use, right?
Yes, sir.
You don't need to be told that this is for what? External use. Then rhubarb powder. I want to browse. I want you to check this thing up. Check rhubarb. What is rhubarb used? You can see the spelling, right? Google it. You can Google that one. Rhubarb. What is rhubarb used? These are things you should have in your note. You use it. Put down what is used for. Put it down in your notes. If you have learned that one, you've learned that one. Put it down. You tell me tomorrow. Then, so rhubarb powder is used in dyspepsia. Have you heard of the term dyspepsia? Dyspepsia. By now you would have gone through this material. By now you would have gone through this material, and check out some words you're not familiar with. So another thing I want us to be doing is this. If you come to class, if I call any word and start explaining the meaning of that word, you can forget it easily. But if you use your pen, use your hand, put it down, check it up on your own, write down the meaning in your note, you can never forget it in your life. So that pattern is what I want to be using for you guys. Except maybe if you search for it, you couldn't see something meaningful. We can now discuss it. So for that, now put down dyspepsia. Am I communicating? Put down dyspepsia. Find out what it means. Then chlorhexidine dusting powder. You know, when dusting powder may contain different active ingredients for different purposes. Am I communicating? Now, chlorhexidine dusting powder is used as antimicrobial. It's used as what? Antimicrobial. Antimicrobial. Chlorhexidine dusting powder is used as antimicrobial. Of course, you know what antimicrobial is now. You know what it means? Fight micro what? Organisms. Antimicrobial, especially those that are pathogenic. Those that are pathogenic. Am I communicating? Good. Now, another one is Dover's powder. Dover's powder is used as an antipyretic. Antipyretic. Dover's powder is used as an antipyretic. Write down the word antipyretic. Find out what it means. You tell me tomorrow. Write down the word antipyretic. Find out what it means. You tell me tomorrow. Then, Dover's powder contains ipecacuanha and the opium. These things are active ingredient extract of plants. These are natural extract from plants. The active ingredient there are ipecacuanha and the ipecacuanha and opium. These are active ingredients. They are used as antipyretics. So find out what antipyretic is. If possible, put down opium and ipecacuanha. Find out where the plant through which where you get ipecacuanha and opium. They are from plant. Tell me the plant they can get them from. What are people doing in AUM now? You are discussing. Have we started talking about drug? Where you can source drug? Yeah.
No.
What topic have you done so far?
Okay, I thought about robot has not gone.
Have you done anything about drug source? Where where drugs can be sourced, whether from plants or animals or synthesized? And that's what I say. So this assignment now giving will help you to appreciate what you are doing in AUM. That's why I said look for write down this ipecacuanha and opium. You are seeing them on the screen, right? Write down ipecacuanha and opium. Look for where the plants where they get them from. At the same time, what is their pharmacological action of it? What can they be used to treat? Why you also tell me the meaning of antipyretic in our next class. Hope you are putting all these things down. Good. Now, magnesium trisilicate powder. Magnesium trisilicate powder is used as antacid and anti-flatulent. I think we talked about this one, right? We discussed this in your class. Antacid and anti-flatulent. Write down. You know the meaning of antacid now, right?
Yes.
Good. Write down anti-flatulent. Find out the meaning of anti-flatulent. What do you mean by anti-flatulent? Find out. Please, these things I'm telling you, don't joke with them. Judiciously browse these things by yourself. Write it down. Understand it. It will help you. It will help you a lot. All right.
So what about Muju powder?
Hmm?
Muju powder.
What does it contain?
Just, I
Hmm?
don't know. I'm just asking because it's also in this situation where there is no dust important, who use it? It
Good,
also
good.
uh,
Can you hear me?
yes, sir.
I like what you're bringing up. You are coming from a layman's level. In the past, maybe in the past 7 months, right? You are just a layman. uh You are coming from that layman's level, which is okay. You are bringing what you have seen what you saw that time. Muji Paradox is wonderful. I like it. But now that you are now in this situation, now becoming more professional now, I want you to go back to that thing you were seeing that time. Look, check the component of it. Are you there? So I'm challenging you now. Go back to that thing you are using that time. You are seeing people using. Find out the component of it. The component of all the component of the Muji power. Find out the components. Write them down. Write down the strengths. If possible, self. Find the each. Are you aware that that's another thing I wanted to know about dispensing. Every ingredient used in any for the production of any drug, any medicine, they have any ingredient there has something they're doing there. So if you find out these ingredients, and their amount, their strength, also try to go a step bit to finding out what role are they playing in this medicine. Why did they add this ingredient in this medicine? What role are they playing? Am I communicating?
Yes, sir.
So you do it, write it down properly. In fact, what I want us to do is I want this class to be a hot one, a contributory one. If possible, write it down very well. Then, then send it to me on phone. I will share it here as we talk. You'll be seeing it and be telling us what you did. Is it okay?
It's okay.
Is it okay? Good. Let's do it that way. Find out the component. Find out what the the role they perform in each of them. Send it to me before the lecture so that I'll see it. Then I'll share it here. You will not be seeing what your work and tell us things about it. Then I will not know where to come in from, where to come in. All right, let's continue. I like what you're doing, but I want you to now look into it professionally. There may be some things people were doing at home when you were still at home, doing all those things. They need to do this one, get this one, call it drug, and call it medicine and take. Now that you are here now, it is now time for you to really reinvestigate all those things they are doing. Know the one that is correct, wrong, and the one that is right. Those drugs they are using that time, you don't know the content. This is time for you to now look back and know the content. It will help you to grow in this profession. Okay? All right. Only one person is talking here. What is going on? Only one person is active in this class. Arinze Chisom. I'm seeing strange names here. Who is Arinze Chisom again? Okay, yeah. Arinze Elizabeth, right? Good.
And
Uche Naomi. Who is Ziaomi? Please change this thing to your real name, please. I don't have Ziaomi in my class. Ziaomi 2106114 now. Change it to your real name, please. Let me know when an intruder has entered. Okay. Please, Chizzy, who is Chizzy? Change it to your real name, please. I don't want nickname here. Okay. Please. Now let's continue. I promise you something that this class will not be long. I don't believe in too much long class. I believe in short and effective class where you can interact, go and do other things, come back again and continue. Is it clear? All right.
yes,
So we are still talking about use of powders. Powders are also used as antiseptics, and that term has come out. Write it down. What is write down the meaning of find out the meaning of antiseptics. These are things we'll discuss. All this is I'm telling you, write it well, write it well, tablet, write it out well. Write it out well, then send the assignment to me before class. I will be sharing these things, what you wrote. So don't go and kick our nonsense. I will be sharing what you did. Those that are from there, I will know those that are doing the assignment. If you copy your neighbor, I will know because you send it to me on my WhatsApp. You send your assignment to me. If you copy somebody, I know. These things have mark. If you like, don't do it. So powders are also used as antiseptics. So write down antiseptics. Find out what the meaning of the term antiseptics. What do they mean? What does it mean, antiseptics? All right. So now let's continue. You'll be hearing antiseptic. Is it the first time you heard that term before now? Okay. Find out the meaning. Write it down. Now, ibuprofen powder. Of course, now, please, who is disturbing us? Who is disturbing us? If you are in a noisy environment, mute your phone, mute your mic. That's how to do it. All right. All right. So we have ibuprofen powder is used to treat juvenile arthritis. Ibuprofen powder is used to treat juvenile arthritis. You know what arthritis is now? You've heard the term. You've heard the term arthritis, right?
Yes.
Good. So I don't think arthritis is a new. Even though you must have known it out of maybe from a layman's understanding, but it's deeper than that. I wouldn't want us to go into it because it's what you still do when you come up in your AUM. Am I communicating? But just know that it's used to treat what I want to find out is, in fact, write down juvenile arthritis. I think it's better. Let's do it this way because that term juvenile means something. I don't want to say it here. Write down juvenile arthritis. Check juvenile arthritis. Check what it means. So this assignment now, you write it well, neatly in your note. Don't use piece of paper because you may lose piece of paper. Are we there? Don't use a piece of paper. Am I communicating?
Yes, sir.
Don't use piece of paper because you may lose piece of paper. Write it well in your note. Write it down well in your note, neatly. Then use your phone to snap it and send me. So that even if you send me, you still have it in your note, go through it. I'm teaching you life, not just to pass exam. What I'm teaching you is not just a passing exam alone. What you look up to when you leave this place. So write juvenile arthritis. Tell me one or two things about it. Don't limit yourself. Tell me anything. Don't limit yourself. Write anything you know about it. Am I communicating? Now let's conclude this. Now, any other thing we are seeing here are not. We've discussed clinical and pharmaceutical use of powder. Any other thing we are seeing here are just in bakery. Powder is used as aluminum is for what? There's this thing there's this brand of baking powder they call Romford. Romford is a brand of baking powder. It's used as baking powder. But one thing about Romford is that it's aluminum what? Free. You know, there's this issue of aluminum baking powder being contaminated with aluminum. There's this issue about it being contaminated. So they're trying to the Romford powder is presented as being aluminum free. Am I communicating? So this one is not a pharmaceutical use. It's not a clinical use. It's just used in the confectionery industry. You know what confectionery industry is, right? You know that, right?
No, no, sir.
Confectionery. Okay. Don't worry, you will not look up for this one. Let me tell you. Confectionery means bakery now. Bread, biscuits, all those snacks. Am I communicating? And so
Yes, sir.
let's continue. Yeah, then use of powder. We want to conclude with this use of powder. Powders are also used in cosmetics. Of course, now you should know this one. Now you are Mary Kay. Uh-huh. But if I ask you use of powder as a pharmacy technician, you go and start telling me that it's used as Mary Kay. You fail. Oh. Start from what? You are pharmaceutical and clinical use. Am I communicating?
Yes.
Don't come and start telling me powder is used as Medicaid, powder is used as baking powder, and you stop. No, you didn't write anything because you are not a caterer, or whether are you a a makeup artist. Focus on the one that concerns you as a pharmacy technician. Then after writing that one, you can use this one to make it up. You just an addendum. It can also be used in other industries like in cosmetics, in beauty, for cosmetic purposes, and confectionery as baking powder. So this is where we draw. Okay, are we there?
Yes,
All right.
yes, sir.
So so there is this prickly heat powders. We had one we also call prickly heat powders. They are used to relieve skin burn. Are you aware that there are some people that experience this skin burn if they stay under the sun for a long time? Are you aware? Skin
Yes, sir.
burn. Have you heard of this before? Skin burn.
Like, do you know?
I had there are people that experience so. Yeah,
Yes.
powder can also be used to relieve this skin burn. Of course, now you know that powder is just if they want to during the napkin era, during the napkin era, even in Pampers says they still put powder. True of us, where we're wearing babies, their napkin or Pampers. True of us.
Nowadays, they don't put powder. But nowadays, they don't put powder.
Ah,
You know that powder is no more preferable. It's Vaseline.
wow,
They rub it on the body, then they now put it.
wow. That's good. That's good. I like that. But I'm telling you, basically, they use powder for that. Am I communicating?
Yes.
Yes. They normally use powder for that. So, in the this one is a new one, a new thing, wonderful. But they use it to avoid nappy rashes. They use it to avoid nappy rashes. Okay, this is we call it a day. Um, we will stop here in powder. In our next class, we'll continue with granules. Thank you very much for your attention. Good night.